Well, treating heart disease by changing your diet, it's important.
Absolutely. News 8's medical reporter Jocelyn Momenta speaks with a specialist on how to incorporate healthy eating.
All February long, St. Vincent's Medical Center has been raising awareness for Heart Healthy Month. Today we have Dr. Venu Channamsetty to talk about how we can prevent heart disease with healthy eating. It's great to have you with us.
Thank you for having me.
You're a cardiologist, and obviously a lot of your patients come in. They always want to know what can they do to improve their heart risks. What do you say to them?
Yeah, that's right. You know, heart disease, first of all, is the #1 killer in both men and women. But fortunately, there are certain lifestyle changes we can make in order to prevent or try to prevent heart disease. One of the things I always talk about is these quick fix fad diets that a lot of people have adopted. And the truth is, this is not the best way to prevent heart disease. We really need a long-term goal because this is what's necessary to keep the arteries flowing with blood and prevent any blockages.
The quick fix, generally, they only last for just temporary, and then you put the weight back on, which is obviously a health risk for people with heart disease.
Exactly. It's a short-term thing, and it's not what we're interested in as far as preventing a long-term problem such as heart disease.
So it really comes down to lifestyle changes.
Right. And, you know, a lot of people, they'll obviously ask me, so what are good foods and what are bad foods? And as some of us have realized, there's actually a lot of conflicting information out there. First of all, for example, I think for decades we've always been told stick to low-fat diets. All we heard was low-fat, low-fat, low-fat. And it's true, some low-fat is good. It's important to avoid fats from animal meats, red meats, things like that. But I don't know if you know, some fats are actually very good for you. These are called good fats. They're found in fish, avocados, nuts, and in moderation, we should try to have some of those.
Yeah, because when you hear that, then you say, okay, I can eat all that, but you really need to still have some self-control.
That's right, everything in moderation. And, you know, it's important to know that a lot of new science, basically it's been indicating, it's made sugar more the culprit. And it's true. What happens when we eat a high sugar meal or high sugar diet, our body secretes bursts of a hormone called insulin. Insulin is necessary for sugar regulation, but when you have these bursts of insulin, our body eventually becomes resistant to it, creating a state called insulin resistance. Now, insulin resistance puts us at risk of a lot of diseases, including diabetes, hypertension, and heart disease itself. So
it sounds like we really need to avoid sugar as much as we can, as well as processed foods.
Absolutely. Stay away from sugars, processed foods. I tell my patients to eat food that are high in lean proteins, high in fiber, low in sugars, carbs, and processed foods.
You say it works, but sometimes for some people, they need a little more help. So is that when you have to prescribe medication?
You know, I try not to prescribe medications. I think I try to stay conservative. We could really use our own willpower to some extent. But I'll tell you a patient story, for example. One of my long-term patients, he just could not cut down on food. Basically, he liked food, and he couldn't cut down on the portions. I gave him some advice. He used to always go for seconds and sometimes even thirds. I told him, try this. Eat your portion that you're planning to eat, and tell yourself you can have seconds or even thirds, but just wait about 20 to 30 minutes before you do that. And the reason I told him this is because that's about how long it takes for our intestine to tell your brain that you actually feel full. You see, there's a hormone that our body secretes called leptin. Leptin is secreted from our body in response to a meal, and it has to act on our brain for us to actually feel full. So basically, you have to give it that 20 to 30 minutes.
And also, it would be a good thing if you just slow down your pace. Eat slowly.
Absolutely, and that's for the same reason. You have to kind of give some time for the process, for your brain to actually know you're full. So, you know, this particular patient, he tried that, and it really worked for him. He lost a lot of weight, and actually I was able to take him off one of his blood pressure medications, and he was very happy about that. And no medication was needed, just simple lifestyle changes.
Great tips, Dr. Channamsetty. So appreciate it. And we also, for those of you who need more information, visit stvincents.org/heart.